I'd like to call the meeting to order, begin with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
First item up is approval of the agenda as presented. Is there any additions, modifications?
I don't have any.
Hearing none, I'd entertain a motion to approve the agenda as presented.
I make a motion.
I second them.
All those in favor?
Aye.
First up is our, we should have public comment. Marilyn Ewing.
Marilyn,
Marilyn?
You can come
You'll be the
ahead up.
first one.
just come up to the podium, Marilyn.
Well, I'll try to make this short and sweet as possible. I recently moved back to Perry County. As I was telling some of the ladies before the meeting started, I raised a family in Perry County for 30 years. I lived in the county around Derby, Indiana. One of my daughters passed away before I moved. She was killed in Alcoa. My oldest daughter moved to Louisville. So, and then my husband passed away a couple years after I lost my daughter. So I was not really happy and content to be in Perry County at that time. And I moved away and lived in New Albany for about 25 years. When I came back to Perry County, and the reason why I came back is my daughter that lived in Louisville, had breast cancer, and she passed away last spring. So I wanted to get closer to my son. And so I didn't want to buy a place, and I didn't want to live in the country anymore because I'm 85, I can't mow grass, and I don't want none of the responsibilities. But when I moved back and rented a place, you have to live by other people's rules and regulations. And living in the country, you always took care of your animals, whether it be horses, cats, pigs, whatever. And that was always instilled to me, to take care of the animals first. I saw so many stray cats where I live that it amazed me. I never seen so many cats running loose in a city. I lived in New Albany for 25 years, and rarely did I see a cat running around, let alone a skunk. And I was just surprised. So I was wondering about animal control because I know that they did have animal control in New Albany, and I'm not trying to, I don't want to upset anyone. And I understand this is a smaller city and all that, but I was asking questions. I'm wanting information about what we could do to possibly do more about animal control. I can't feed the cats where I live because there's rules. I live at someone else's property, and so I have to follow their rules, or I won't be living there anymore because they're not going to allow me to, which, that's their job. They have to follow their rules. So what I'm looking for is information and what we could do to find a solution to maybe keep all these stray cats. The neighbor that lived across from me, her name was Beth Brown. I knew her as a kid, and she said in their barn there was cats that would have litters every year. She was always lucky enough to find homes for them. But there's so many cats running around in the streets and the alleys. I was just amazed, and cats can have litters up to 4 times during the year. So the problem's not going to go away, and the shelter can't take any cats. They're just full up. And so I'm just looking for solutions and brought it to you to find out maybe what we could do. I have a little bit of a solution for myself. I can help because I have an environmental fund that would go to help, to do something. I talked to Jim Carter, who is head of the Humane Society, and he's 83. And he's trying to get younger people to come in to help him because, you know, you're past your time when you get past your 80s.
We have a animal welfare and control and education board, and I'd be glad to give you their names and
Oh, I would appreciate
to
that.
talk to them to see what they are doing maybe too. And they meet once a month here at the courthouse. So
Okay,
I will get that. Can you write down your name and phone number, and then I will,
I sure will.
and then I will get that to you.
Okay, I'll write that down and get it to you.
All right,
Thank you very much.
Thank
That
you.
was my concern.
Welcome back to,
Next one up is operations, mind, body, soul, and I guess veterans
Veterans
combo.
of Perry County.
Wait a minute, we got,
Put it under agenda.
have you got the same one I got?
Wait a minute. It's the last one she sent out.
That's why I was trying up for person.
Is this the one I'm supposed to be using?
somewhere.
Well, I had him down in the bottom, but he said it's not
This is the
necessarily
one you
here.
sent me.
Yeah, he's not necessarily here.
I'm not here as a
Yeah,
veteran service
he's-
officer.
Yeah, so I meant to move that to public comments, but I think it got moved to approval of the agenda.
So which one am I supposed to be following?
I don't know, I got two.
Well, I was going by this agenda up here where it says Operation Mind, Body, and Soul Veterans of Perry County.
That's the one I got right here.
That's what I have also. I think you don't have that.
This is the one she scanned out.
Yeah.
So
Okay.
we'll follow this one then. You guys are on.
Okay. So I'm Boone Taylor, the founder and president of Operation Mind, Body, and Soul. We created Operation Mind, Body, and Soul in Lewis County approximately 2 years ago. We've had great success with it there. Met Kevin through the VA, Misty Painter, and we're wanting to do the same thing here. We already have a facility up and running, but what we're asking for today is on our paperwork, and you guys can read along if you would like. Do you guys have?
Yeah, we sent that email and we could get it up on.
So it's the 2-year pilot program proposal opioid settlement fund request. And we have copies of this if you would like.
I got it, thank you. You have yours?
I think I read it.
I read one
Are these
that's
all
good.
one
I had
packet?
home.
Yeah, everything that we're about to discuss is in this packet, and I sent the emails on Friday
Yeah.
and yesterday, and I asked for it to be able to be shared on the screen and sent out on YouTube for the public to see.
Can't do that.
Why can't we?
We can't share the screens to the public. All that they can see is the camera. The camera's right there.
Well, we're going to present it anyway, so
Okay.
that's fine.
You're good.
Okay.
Yeah.
Okay, so the executive summary, Operation Mind, Body, and Soul in partnership with Operation Mind, Body, and Soul Veterans of Perry County respectfully submit this proposal requesting opioid settlement funding for a 2-year pilot program designed to support veterans' mental health, substance use prevention, and recovery through physical wellness and peer support. This proposed program establishes a veteran recreational and wellness space here in Perry County that provides structural fitness activities, peer connection, and direct referral pathways to behavioral health and recovery services. This initiative aligns directly with the Indiana opioid settlement abatement priorities. Program proposes in need. Veterans in rural communities face elevated risk of isolation, untreated trauma, substance use, and suicide. Perry County veterans often experience barriers
I didn't print mine off.
to consist mental health and recovery services. Research consistently demonstrates that physical activities, peer engagement, and structured community support reduces these risks and improves long-term outcomes. So what we're asking is a 2-year program, year 1, program launch and foundation, $60,000. Facility setup and enhancement for veterans, recreation and wellness space. Purchase of fitness and wellness equipment, part-time program coordinator, and veteran peer mentors. Weekly peer-led activities and structures, fitness sessions, monthly mental health and recovery workshops, baseline data collection, and quarterly reporting to Perry County Commissioners. Year 2, would be continuing the program coordinations, peer support, staffs, expand outreach and underserved rural veterans, equipment maintenance and limited replacement, continued partnership with the VA and community providers, outcome evaluation and sustainability plan, reduced reliance on opioid settlement funds. Then it goes through like our budget. You guys can see that, so I won't go over all those numbers, but we are asking for $60,000 the first year, $40,000 for the second year. Expected outcome of this: serve 75 to 150 Perry County veterans and first responders over 2 years, increase peer connections and health coping strategies, reduce risk factors associated with substance use and suicide, strengthen local resources, networks, and treatment and counseling, provide clear return on investment data to the county leaderships, sustainability beyond the pilot program. By the end of year 2, Operation Mind, Body, and Soul will transition the program towards sustainability through private grants, donations, VA, and state funding opportunities, and community partnerships. The goal is to reduce and eliminate reliance on opioid funds, settlement funding, while preserving the program as a long-term community asset. Formally fund request: Operation Mind, Body, and Soul in partnership with Operation Mind, Body, and Soul Veterans of Perry County respectfully request approval of $100,000 in opioid settlement funds over 2 years to implement this veteran recreation and wellness pilot program. Then on to the next part. This is our talking points. And of course, this is just kind of repeating what I just said. What we're asking for approval is the approval of $100,000 opioid settlement funds over 2 years, 60 the first year, 40 the second year, to support veteran-focused recreation and fitness programs. Why this qualifies under the opioid settlement: addresses opioid risk factors through prevention, behavioral health, and recovery support. Targets veterans, a population with elevated substance use and mental health risk. Creates a safe, sober community space aligned with approved abatement categories. Includes outcome tracking and transparencies. Why a 2-year pilot program? Year 1 launches and establishes baseline outcome. Year 2 establishes operation and reduction county investment, allows commissioners to evaluate the effectiveness before long-term commitments. The outcome would be 75 to 150 veterans first responders served over 2 years, improving peer connections, mental health stability, reduces downstream crisis and treatment costs. Bottom line, this proposal uses opioid funds exactly as intended: upstream prevention, recovery support, and community resilience, while maintaining fiscal responsibilities and transparencies. The next one kind of gives us some stats from the Indiana Department of Health and Veterans Administration data. Approximately 140 to 150 Indiana veterans die by suicide annually, with the veteran suicide rate of 36.5 per 100,000, significantly higher than the general population. Indiana has over 400,000 veterans, and veterans account for up to 15.7% of suicide deaths statewide. Additionally, Indiana reports over 1,136 suicide deaths annually, and more than 2,558 overdose deaths per year. Law enforcement officers, first responders face particularly high risk of studies showing 23 to 25% of officers report experiencing suicidal thoughts during their careers. These statistics demonstrate the urgent need of mental health, peer support groups, prevention, recovery services for veterans and first responders. Operation Mind, Body, and Soul provides peer support, mental health stability, and prevention programs aligned with Exhibit E, approved opioid settlement use, and Indiana Code IC 4-12-16.2. Support program that addresses veterans and first responders' mental health directly contributes to suicide risk, substance use, and opioid-related harm within Perry County and surrounding communities. Sorry, I'm trying to get through this quick for you guys. So our mission, Operation Mind, Body, and Soul, and of course this is repeating itself some, but it does have other things involved in it as well, so keep going. Mission, Operation Mind, Body, and Soul provides mental health support, suicide prevention, peer support, and recovery stabilization for veterans, law enforcement, and first responders. This population faces risk of PTSD, depression, substance use disorder, and suicide due to trauma exposed and occupational stress. Who we serve: military veterans, law enforcement officers, firefighters, EMS, individuals in recovery at risk of substance use disorder, community members affected by opioid harm. The core program services, Operation Mind, Body, and Soul provides structured community-based programs focused on prevention, mental health stability, recovery support. This program includes peer support groups, mentorships, veterans, first responders, peer support, programs that reduce isolation, provides accountability, and improves long-term mental health outcomes. So we not only get them better, we keep them better by providing the services that we provide. Recovery stabilization services support programs that promotes long-term recoveries, healthy routines, and integrated into family, work, and community life. Fitness-based mental health programs, structured physical wellness programs proven to reduce depression, improve resilience, and lowers substance use risk. Community education and prevention, outcome and education focused on opioid prevention, mental health awareness, and early intervention. Opioid settlement alignment. Operation Mind, Body, and Soul provides services fully approved opioid settlement remediation use under Exhibit E, Indiana Code IC 4-12-16.2. These services include mental health, peer support groups, suicide prevention, and sorry, I'm laughing because it just keeps repeating itself over the others. Community impact would be programs help reduce suicide risk, prevention of substance use, improve long-term recovery outcome. Then I'll skip down to the other. Eligibility of the opioid settlement is Operation Mind, Body, and Soul is eligible provider of opioid services and provides the support of Perry County's opioid settlement goals through evidence-based, community-focused programs. Yes, we did submit the same 2-year pilot program to Du Bois County. We asked for $60,000 for the first year. They did. They gave us $52,000. There was a couple other people that came forward and asked for it. So, but they gave us the majority of what we asked for. And this is helping the people that are damaged from the jobs that they do, the country that they serve, and it's about time we get back.
And that money's for Du Bois County veterans
Yes.
and first responders. That's for purposes for Du Bois. So here at Veterans of Perry County, our chapter of Operation Mind, Body, and Soul, our focus is the veteran and first responder community. We set up programs. We have Operation Fitness, where we're going to offer to pay gym memberships for veterans and first responders to get integrated into the gym and get a workout program. If these veterans and first responders need a workout program created for them, we will pay for 4 personal trainer visits. We have coordinated with both gyms and have this set up. They have spreadsheets ready to keep track of our veterans and first responders. They will have to do at least 3 days a week in the gym for us to be able to reimburse their membership. That's the conditions, and that's how we're going to get them focused on working out. Operation Hike is something we're going to do monthly. We're going to meet up in the Hoosier National Forest. We have guides. right this month on March 14th, we got Bernie Overstreet doing a guide for us at Saddle Lake, 2.6 miles around Saddle Lake. Veterans, first responders just meet up. It's collaboration. It's social networking. It's all good for mental health. We're going to go on a hike. We're going to do that once a month. Also, Operation Cleanup. We're going to meet up once a month somewhere in the community in Perry County. We're going to coordinate with the Key Club and Honor Society and also community corrections and get community service hours for people and let them clean up different parts of the community, just a little bit of community give back. Operation Recovery, we're going to run that in our office at 140 Indiana 66 East, right there between Circle S and the movie theaters where our building at. We're going to offer first responders and veterans recovery. That way we separate them from general public. Veterans and first responders go through the same type of mental health struggles. You know, we serve people, we go through traumatic experiences, we all relate. The good thing about veterans, though, we have the VA administration to help take care of us when we get out. First responders don't have that. They don't have a VA that helps them cope with what they experience while they're on the job. So with what we learn in the VA system and the different therapies and different programs that we go through, doing this type of service peer-to-peer, we can put what we train as the VA into the first responder community and help them, you know. And if we get to the point where we cannot handle somebody and it's above our peer-to-peer and they need professional help, we have the Mental Health Coalition that is attached to this nonprofit. It's a committee. It's a 36-person committee. It's all the mental health providers in town, community leaders, police chief, sheriff, probation, everybody. I mean, there's a long list, 36 people. That's a resource team that we can use. If we have somebody in crisis, we can reach out and say, hey, we got this person. What should we do? I've already used that 3 times in the last 2 months. Got a first responder that left his job and went into the civilian world, struggling, got him help. There's been 2 others that's reached out, got them help, all from that resource.
Not to interrupt you, last year we had 8 veterans that reached out to us and all 8 are still here.
And, you know, over the years, I've, you know, been doing this and, you know, and putting this organization together to be able to support more veterans, support law enforcement, support all the first responders. And that's a huge population. Almost 10% of Perry County's veterans. If you throw into the first responder community and their families, we're talking 30-40% of our population in Perry County that we're targeting. Now, that doesn't mean that you have to be a first responder and veteran. That's our target. But if you're somebody that needs help and come out, we ain't going to turn you away. If you want to go on a hike with us, you want to come to, you know, some kind of event, it's open to everybody. But our target is veterans and first responders.
Well, not to mention that, you go with the families that struggle just as much as the veteran themselves or the law enforcement as well, then you even up that percentage even more.
Yeah. And our plan is not only veteran and first responder recovery meetings, support groups, we're going to do spousal support groups. We're going to do elderly support groups, widow support groups. One of the biggest things I face in my office as a veteran service officer is widows not having help. And a lot of widows have depended on their husbands or wives, you know, all these years. And I have widows that never paid a bill in their life, you know, never opened mail up. And they come and they're lost. They don't know what to do. And I can only handle so many of them in my office. But putting a support group together to be able to reach out and say, hey, I got somebody. They need help. And, you know, and I have widows that are ready to help be on that committee and be on that board to help us because they experienced it and they want to help others. So, I mean, all around, this is a great organization. We have a team of people. We have the Stratmans, Candace, and Daniel Stratman. Stratman retired from the Marine Corps last year, 20 years. His last detail was on the President Biden detail. He's on the Marine One. We got Misty Painter. She's part of the committee for recovery. She's the little VA suicide prevention coordinator. We got Brendan Chandler. He's in the Indiana National Guard. He's the suicide prevention coordinator for Indiana National Guard. We got Curtis Bennett. He's in the recovery committee. He's one of my veterans I've helped over the years. We have my wife, Christy Hurt. She's a program director for Urban Valley Mental Health in Owensboro. And she's going to be part of River. And she's opening a men's house in Hallsville that's going to be opening up soon, starting April. And she's going to be running that house. So that's a resource that we could have to be able to send people to get help. And that's an inpatient facility. We got Sally Mosby and her husband, Aaron Mosby. They're local business owners. Thunderbolt Ridge Farms, Mosby's, Lawn Service, and I think there's more, but I can't keep up with them all. But we have a lot of people, and then on top of that, the Mental Health Coalition that's full of community members, community partners. We have partnered with, reached out to Perry County Groves to come to the ribbon cutting tomorrow. You know, we want to collaborate with them with nutrition for this program. It's a lot of good things, and a lot of good things coming to Perry County, and we are here to ask for support. We're here to make this request for this proposal for the opioid funds. I know it's a big request, and it's a lot of information all at one time and very quick. And I understand that you can't make a decision now, that's fine. But if you could, come tomorrow to our ribbon cutting. And if you don't want to make a decision today, table it to your next meeting. Come to our ribbon cutting tomorrow, check out the facility, get more information, meet people, have some refreshments, and then we'll come back at the end of the month and we'll see what you think.
And this will also reduce expense as far as law enforcement. If we can get these people better, keep them better, it's going to bring down crime, it's going to bring down domestic violence, it's going to bring down a whole lot of other things that we're spending money on already. So this program's designed to be a win-win.
And it's just going to, well, people that we target, it's just going to help others too, because as they get help, they can help others. You know, it's contagious.
First of all, thank you guys. Absolutely.
I think
Thank you.
you've got a lot of great ideas, and then I'm glad to see public support. That's what makes it all come together.
And we've already, sorry, didn't mean to interrupt you. We've already done this in DuBois County, so we've already done the hard part of it. All we're doing here is just following that blueprint.
The one thing that you mentioned through that I looked at, you talked about law enforcement and first responders, and I know we're in the process right now trying to hone the skills of first responders, get them more active and get them involved in that. And I would really like for you to reach out to them to see how this could all be coordinated.
Oh, yeah.
Because I know the county puts in like 120,000 in mental health, I think currently, so that, you know, we're not duplicating services that one of the others, so that it all kind of coordinates, so everybody's comfortable and on the same playing field, and we're not, you know, so we maximize our use of the resources when we do it.
I have a meeting today with Bryce Hammock, and we're going to discuss how we can do this together with him running for sheriff, and also Roger Smith. I'm going to reach out to Roger. I'm going to reach Derek Llewellyn, talk to him, and then also the fire, EMS, reach out to them and coordinate with them. And
Don't leave Dave Falkenberg out. He's our current.
Oh, yeah, Dave
sheriff.
Falkenberg's on my mental health coalition.
Yeah, just so, you know.
Oh, yeah.
And I know that you probably want to include the hospital and the EMS service, because they're going to face a lot of similar things when they pull up and open the doors to whatever.
Well, the thing about
affects them.
like
And
the 120,000 that you mentioned that the county contributes to mental health, that's to professional providers. We're doing a peer-to-peer, vet-to-vet, first responder technique. And that by proving by mental health, that's the best therapy you can get is person to person.
Oh, I don't doubt that a bit.
Yeah, so that's our goal and our mission. So we're not in the professional field. We're just experienced people that's dealt with it.
But I think you need guidance from those, because there's a lot of people that could potentially be on the edge, and if you're not fully trained, it's like sending a first responder out and you've never trained him. The outcome may or may not be positive. So you want to make sure whatever you carry out, it is positive and correct. And I think those people can play a part in guidance and how you handle that.
Actually, just last week, I was training our police officers, crisis intervention, trainers.
Bingo. That's exactly what I'm talking
And I
about.
forgot to mention to Misty Painter for Little VA. I just realized, sorry, Misty, that I missed you.
We need to look into this. I'm going to share this with you. I did this for my own use last night, just to give you an idea. 26 and 27 is ugly for Perry County as far as finances are concerned. And I'm not going to speak for the council, but they did not fund, that I know of, an organization in 26 that was a nonprofit at all. And I don't know that they'll do that in 27, and they rated some other accounts to get through 26. So funding's tight. So what I did was I pulled up opioid money just for my own use is why I did it. We have expended money out of there in the sum of, they all went to Perry County Memorial Hospital. $25,316, $26,335, $32,186, and $96,524. That was all related to EMS services to make sure that they actually were compensated for what they carried out. And that's the restricted fund. In the unrestricted fund, and probably a lot of people don't know this occurred, but we had a storm siren up in the Rocky Point area that was mounted some time ago, too low. When we had our floods this past spring, it ruined it. So we took the unrestricted funds and utilized that to put that siren back in place to serve those people. And then it's had basically one sheriff car pulled out of it. So that's what the money's been used for up till today, just to give you an idea.
Just curious what's left in the opioid fund.
Well, the unrestricted has 57,000 and the restricted has right at 100. That's what they've got. So, but I don't know exactly what the council's plan is as far as sheriff department vehicles and what.
Is that restricted funds or unrestricted?
Unrestricted is where they bought the car out of.
So the restricted funds are for like mental health.
Well, the restricted funds have a lot more rules, but it has to be health related. And when you talked about first responders, we can get, and this is something you need to be aware of, through a lot of these charitable donations like Narcan. And the first responder program is looking to put those out into the community in different boxes in different areas. And I can see working together with you guys, them and that, where those are available so that if you have someone trained, they can get access to the box to help the guy 3 blocks down and save his life. And it's going to be more than just that. So it's a situation where you can react. The more people you have that's trained and available, the better the system will work. So I truly believe coordination here and working, I think this can work out. We just have to figure out how to fund it and make it happen. So
We actually gave out suicide prevention packs to this police department and all the surrounding counties. So it's a suicide prevention pack that has a gun lock in it, Narcan, and a drug deactivation kit in them. So if you have to get rid of prescription drugs quick, this isn't so much for the person that's suicidal, but if it's a family member, those packs, and we give them to the police officers because they're the ones that do the welfare checks. So we've already provided a lot of that stuff free of charge to our counties.
right, and they're on duty all the time, and they're the ones that's able to respond quickly.
Right.
So
And I did do that for our Tell City, our sheriff, and Hamilton police departments last year.
So we're already assisting in those ways to help. And that's because they have to come to us. They're going to call the police officers to come and do welfare checks. So it only makes sense for us to start there.
mhm.
So we're already working a lot with our law enforcement
Good.
first responders.
Good. I think it can all work
That's
together.
good.
That's
Thank
what we
you,
got.
guys.
We would like to see you tomorrow though, 11 to 12 at our river cutting.
Thanks.
Thanks, guys.
Thank you guys very much.
Thank you all.
Next item, Nathan, Health, Region 15.
Are you feeling better, Nathan?
Mostly.
Thank you.
Good morning. I'm Nathan Held with Indiana 15 Regional Planning Commission. We serve 6 counties, so I am making my rounds now to update each of our counties on specifically what we had worked on in 2025. So what I've handed out is 2015 through 2025 Perry County specific projects. You'll see that for 2025, the first 3 on there are the regional grants.
again, your per capita fee that pays in helps to match those grants. So we do build those in. The EDA planning grant, this is the Economic Development Administration through the U.S. Department of Commerce. This is what helps us to go out into the counties and work with our communities and work with you all to help develop projects and do research to find some grant funds. Helps us do that at no cost to you. The NDOT planning grant, and then also another NDOT non-state owned. Both of these fund traffic counts. These traffic counts, NDOT prescribes which locations we do the counts on, but that information is publicly available. Anybody can pull up those counts. So we encourage counties to utilize that. So you're not over counting a road if it's already been done, or that's also there for developers, whoever needs to see a traffic count. We also have our own traffic counting equipment, so we can go out and do on-demand traffic counts if needed. And then also the Tell City Owner Occupied Rehabilitation Grant was funded in 2025. That is underway. So for 25, as far as the grant funds actually received, it's $369,748. But then you also see the years that the grants are actually funded is when they're put in here, but they can go on a year, 2, 3, 4 years even after funding where we're working on those. So I have called those out. The PIDP, the Tell City Port Infrastructure, this is the pier. I should have noted that that is still going on even now in 26. The Federal Highway, the RAISE grant, which is the rail improvements, is ongoing. The Old Perry County Hospital Clearance Project is ongoing still. It's very close to getting closed out. Property is completely cleared now. And then also the EPA Brownfield Assessment Grant. This was, again, another regional grant, but down at the bottom, I did note just under $50,000 of that was spent in Perry County. We, of course, did submit the application that you guys signed on to earlier this year. We submitted that. We're waiting to hear. So if that gets funded, we'd like to see more sites here in Perry County. And then some other things that we've been working on. We did the Troy Zone Map update and also their code book update in 2025. We're working with Cannleton on their code book update. They're pulling together some of their ordinances. We're also the administrator for the Indiana First Ready grant. This is through the Southwest Indiana Development Coalition or Council. And then we're also doing the labor standards compliance for the Tell City lead line replacement project. And then the other thing that we're working on, we are putting in an application for round 1 for the city of Cannleton for water improvements. This is through the Office of Community and Rural Affairs. The proposals actually due later this month, and then the applications will be due in June. So we are staying busy. But for this period, from the 2015 through 2025, you'll see that we have worked to bring in over $25 million in grant funds to Perry County. So,
That's good.
and the grant funds are still out there. Things are getting appropriated, moving through the system again. So hopefully we will see a lot more coming through here soon.
The $350,000 housing grant,
Mhm.
are you guys managing that?
Yes.
That's what I thought you were going to start that. And
Yeah.
that consists of what?
So
Briefly kind of explain what.
yeah, so this is for the city of Tell City. It's homeowners that qualify for the program, which it's low to moderate income residents. So that will fund roof repair, HVAC, accessibility, and electrical work in their home. So,
And if someone wanted to apply for those funds, they would contact you?
yes, so they have had one round of applications going out and receiving the applications in now. I think, I don't want to misspeak here, but I think most of the funds are spoken for at this point.
Okay.
But there might be another release, if costs come in under, and they can do a few more of those.
And I'm just curious as if there's anyone that wants to apply, they would contact Region 15 office, or where is that?
So the first step is going to the city, but then it will be
And who
referred
who at
to
the city would be the contact person?
just the mayor.
Just
Yeah, when it was put out, Mayor Kale was the contact in his office. And then all of those applications were collected by the city, and then they come to our office for the review, where we collect, mortgage information, all of the income information. And we're not the ones that actually do the scoring, to determine who gets it, but, we make sure everything is in place.
And then who does the scoring?
There's a committee with the city. that
Okay,
does
so the
that.
city's doing the scoring?
Yeah.
Okay, so in other words, if someone has an interest, they would contact the mayor's office for the initiation as far as.
Right.
Okay.
Yeah. And they can always contact our office for questions.
Right.
Jenny in our office is handling that program. So she's the one that the city's going to refer people to. But the first step is with the city.
Okay, and then the current status on the pier down at the port, I know, where does that actually stand?
They are putting together some final design, should be going to bid later this summer.
Okay.
That's been one that, it's drug on since 2021. There was a lot of federal bureaucracy going through an environmental review and people changing and.
So that still looks to be a project that will be completed?
Yes.
Okay.
Yeah, it's a real
That was my
project.
Yeah, because I know there were some questions.
No, it's happening. It just has taken way too long to get to this point.
Okay.
Thank you very much for this information.
Sounds like things are going really well.
Yeah.
Thanks,
yeah,
Nathan.
We're always here. Any questions you have or any need that you have, just let us know. We'll see what we can find out.
Thank you.
Thank you.
And Jonathan Blake's not here, right? So we'll skip him.
It is.
Okay,
They want to stay for the whole meeting.
okay, I'll get a hold of
Tracy
them and have
Fisher.
them call.
Thank you again.
Good morning.
Good morning.
Here for my annual meeting to request your approval and support for the community corrections and the drug court grants for 2027.
27?
I know, we're already doing them for 27. Yep. Yeah, they're due April 1st, so this was the closest meeting that I could get to get them approved. So I sent those out to Chris by email, so if you guys have any
This is
questions
your
on it, this is
reoccurring grant that you fund your operation
correct, yeah.
year after
reoccurring.
year, done it forever.
Yes.
Luckily, you continue to get
18
funded.
years.
Yes.
I think it already went to council, didn't it?
I don't,
Did you go to council?
No, we-
Yeah, okay.
The state statute has that we have to have the commissioner's approval
First.
Yeah,
Yeah.
a lot of those grants, you have to come to commissioners and then go before the council.
any questions?
No.
First thing we need to do before I sign this is, I'd entertain a motion to approve application for the, I'm gonna say community
community
corrections.
Grant, I make
Grants.
a motion.
I second that.
All those in favor?
Aye. Thank you, Tracy.
Yes, thank you.
Let's hope you continue to have
Yes.
success.
Yes, and our budgets will be adjusted if we get any adjustments to the funding. We'll adjust the budgets and
Accordingly.
send it
Thank you.
to Ms. Hammock.
Thanks.
Thank you.
Thank you.
Next item up, we're paying our bills.
Thank you.
Payroll for February 27, 2026, the amount of $168,949.66.
I make a motion.
I second that.
All those in favor?
Aye.
Payroll withholding for the same time, 2/27/2026, in the amount of $35,336.40.
I make a motion.
Second.
All those in favor?
Aye.
Vision insurance in the amount of $287.69.
I make a motion.
I second that.
All those in favor?
Aye.
Dental insurance in the amount of $357.10.
I make a motion.
Second.
All those in favor?
Aye.
Life insurance in the amount of $1,404.70.
I make a motion.
Second.
All those in favor?
Aye.
Medical insurance in the amount of $47,366.78.
I make a motion.
I second that.
All those in favor?
Aye.
Solid waste claim docket for 3, which is March 2nd, 2026, in the amount of $6,294.04.
I make a motion.
Second.
All those in favor?
Aye.
Accounts payable for the same period, March 2nd, 2026, in the amount of $220,903.31.
I make a motion.
I second that.
All those in favor?
Aye.
Aye.
And then we got the check, which we're still talking about.
I
Way
just
to
have
go.
to have it deposited. It'll be voided on March 19th, so I have to have it deposited.
So Andrew he reached out to State Board of Accounts about setting up the fund in order to temporarily set these things aside. He's still waiting, correct, for a response back from them. You have a holding account that you can put it in for 30 days, right, Chris?
Yes.
So I would entertain a motion to put it into the holding account, and surely by 30 days, we will have an ordinance back that meets state statute and everybody's comfortable with it. So, you okay with that? I'd entertain a motion to deposit the check in a temporary fund for 30 days.
I make a motion.
Second.
All those in favor?
Aye.
Aye. Then the next one, Chris, we don't have a PCDC
No.
affidavit.
There was supposed to be another one, but I didn't get everything.
Okay, so we'll mark that off, 7A. 7B is the updated animal shelter contract. We just got that this morning. I'd entertain a motion to table that till we have a chance
I
to
haven't
read it.
seen it.
I haven't either. I saw it come in, but haven't had a chance to read it. So if everybody's okay, we'll table it to our next meeting, give us a chance to review it.
I make a motion to table it.
I second that.
All those in favor?
Aye.
Open board appointment, Ken Rowland sent in his letter, and he served on there probably since probably 8 or 10 years. And he was unaware, that's what I suspected, that his term had expired. And so he sent us his interest to continue on that board. So, any other comments, or I'd entertain a motion to reappoint Ken Rowland?
I make a motion.
Second.
All those in favor?
Aye.
Aye. Next thing up is our meeting is March 17th. That's an evening meeting at 6 PM. I'd entertain a motion to adjourn.
I make a motion.
Second.
All those in favor?
Aye.
When's Easter?
April, isn't it?
Oh, yeah, we don't have, no, we wouldn't have any meetings